Hey y'all, this is Andy Austin. I'm a nurse practitioner for the last 19 years, specializing in interventional pain management. That's my first job, taking care of helping folks with chronic and acute pain. My second job for the last 15 years is owner and lead course coordinator for advanced practice education services. We're going to bring you this continuing education video tonight on spinal stenosis, lumbar spinal stenosis. It's one of the most common pain conditions that healthcare providers see when they're talking about back and leg pain. And I'll be willing to bet people that are watching this video have some of this pain as well. I'm gonna move out the way and we're just gonna talk about it briefly. Lumbar spinal stenosis, I'm gonna explain the drawing here. This is the bony cube called the lumbar vertebrae, okay? It is that right there, okay? That bone and this bone. Basically what we've done is tried to draw that. So if we was to cut you in half and look down, this is what we would see, okay? That's bone, that's the spinous process, that's those bumps on the back that you feel when you run your hand down your back. These are facet joints, okay? These are the joints that allow the locking of the vertebral bodies, these guys right here, okay? That'll be important later. Those are just transverse processes, these little wings. Not a whole lot we're gonna discuss about those. The two areas where spinal stenosis occurs are what's called central stenosis, where you're dealing with the central canal right here. That's represented here. And the neuroforamen. Those are the holes on either side, okay? This is a nerve root. That hole that you see right there is the neuroforamen, and that is the central canal, okay? So typically when people come in complaining of lumbar spinal stenosis pain, they're having pain in the back with standing and walking. The pain radiates down into the hips, down both lower extremities. The pain is worse with standing walking, decreased with sitting. Common characteristics of spinal stenosis pain is sharp, burning pain going down the legs, cramping in the legs, and eventually weakness, or the legs feel heavy or tired. They have to go sit down. Like I said, the hallmark of what we look for when people come in is the pain with standing walking. Usually affects the 50-year-olds and over, although we have seen folks with poor genetics come in their 40s and late 40s have it. Typically, when we go to evaluate someone, we're looking to see, of course, their pain, evaluate their pain, and then also with or without loss of function. And what we're trying to determine is, initially for the initial evaluation, are the legs working, the strength's equal, sensory's equal, that type of thing, any neurological deficits. When you get an MRI of the lumbar spine with someone who's you're highly likely to have spinal stenosis, you're going to either have central canal stenosis or neuroforaminal stenosis. Central canal stenosis happens here. The most common culprit is the ligamentum flavum. That's a big ligament that runs along the back of the vertebral body. And as we age, it becomes hypertrophic. That means thickening. And it starts occupying some of this space in here. These little green dots are nerves. Remember, we're looking this way. And as the nerves are going down, picture the spinal canal stops at T12L1. They turn into this like coaxial cable. And then they split off at each level as they go down in the entire part of the lumbar spine, okay? So that's why they're little dots. So what happens is in central canal stenosis is the ligamentum flavum gets hypertrophied, thickening, and it builds up and occupies space in here, and that's what causes the pain. It puts pressure on the nerves become inflamed, your body detects that inflammation and the chemicals that it releases, and it causes the pain, and it radiates pain down these nerve roots. You'll see people in the grocery store or the mall, anywhere there's large spaces where people are having to stand and walk along distances. They'll start forward lean. They'll start leaning forward. What they're trying to do is alleviate that stress that ligament is causing on the nerve roots. They're leaning forward. In fact, if you go to a grocery store and you feel so much better and you can walk further leaning on that buggy, more than likely, and you're over 50, more than likely you have some spinal stenosis. And keep in mind that this is an overall degeneration of the spine. Lower part of the lumbar spine is affected first. So you're going to have more than one level typically going on. The second type of spinal stenosis is neuroforaminal stenosis. Okay, what's that? What's going on here is these holes here, the neuroforamen on either side, start to become narrowed by these facet joints getting arthritic. Arthritis starts accumulating in the facet joints. It starts occluding these holes and putting pressure on the nerves on this side, okay? One interesting thing is you know, people can have one side a little bit more stenotic, narrowed than the other side. Can be from a leg length discrepancy or scoliosis, that type of thing. You see that? Or then just there's sometimes we just don't know why one side's a little bit more stenotic than the other. But be that as it may, you could have the same type back pain going in, radiating in the hips and thighs, but one side may be worse than the other. Hence, that's the worst side for spinal stenosis. So the treatment for spinal stenosis is maintain function, okay, and control the pain. And there's a lot of different avenues that you could try with that. Medications, anti-inflammatories. Your interventional pain specialist can try what's called lumbar epidural steroid injections. Basically what they're doing is putting a needle into the back of the spine, inside the spinal canal and into the epidural space. And you're injecting steroids, corticosteroids, and it'll help alleviate any of the swelling that, remember we talked about earlier, the nerves become swollen, irritated, and that's when the body detects pain. So that's why you inject corticosteroids in there, to shrink those back down to normal size so the pain gets better and the patient can continue their walking. Everything in regards to conservative treatment revolves around minimizing the pain so the patient can continue their walking and maintain strength. When people come in and we evaluate them and we know they have spinal stenosis, of course we evaluate their level of pain, but also if there's any loss of function or worsening of function. And if we do detect loss of function, in other words, weakness in the legs, their distance of walking gets shorter and shorter and shorter, their time spent walking is less, they don't want to walk as much because it hurts, then, you know, we really have to make a decision. Do we want to have neurosurgeon or orthopedic spine surgeon take a look at them if they haven't already? Physical therapy is real good. They're fantastic working with patients, giving them programs, giving them stretching and strengthening exercises to do on a routine basis. Again, maintaining function, the epidurals we talked about, and of course, back surgery is an option. I have patients, a lot of times they're in that kind of gray area, you know, they have pain on a chronic basis, but no loss of function. And they're kind of stuck in this gray area and they ask, you know, when am I gonna know I need to go have surgery? Well, typically there's two indications for spinal surgery. That is intractable pain, where you can't get relief by any other means, or loss of function, okay? So that's basically, in a nutshell, spinal stenosis. And if anyone knows what the definition of stenosis is, put it in the comments, okay? That's bonus points. But, of course, always, side note, red flags with spinal stenosis. This is the stuff that, you know, happens rarely, but it does happen. When people with spinal stenosis, they develop sudden weakness in the legs, saddle anesthesia, which is numbness in the groin and pelvic area, loss of bowel, bladder control. It's always red flags. You need to go to the emergency room immediately. What that's doing is you're going to more than likely need urgent surgery to take the pressure off those compressed nerve roots. Again, it doesn't happen a lot, but if it does, you need to get that treated as soon as possible. And take home point, back pain going in the hips and legs, worse with standing walking, decreased with sitting. Maintain function, walk, decrease the pain. If you think you have spinal stenosis, get with your primary care provider or interventional pain specialist. Let them take a look at you and see if there's something else out there that can decrease the pain, so keep you functioning and enjoy the quality of your life. I thank you so much for watching. If you like this, you learned something, subscribe. We're going to have some more stuff coming out. And I hope you have a good day. And once again, thank you so much for watching.